Good morning, ma'am. Good morning, sir.
Morning.
Am I audible to everyone?
Yeah.
Good morning, madam.
Good morning, madam.
Good morning. I apologize for the delay. It was just because of some technical issues at my system. Tithi ma'am, are you there?
Ji?
Tithi ma'am.
Good morning.
Morning, ma'am. How are you?
I'm good. I just want to take a trial for the sharing the slide.
Ma'am, just give us a 2 minutes time. Let's start the webinar and then you can share it, ma'am. There won't be any
No, I
issues.
just want to do a trial. I just want to do a trial, so that I'm doing it correctly like that.
शेयर करना है मैं स्लाइड को ऐसे ओपन करके बताइए मैम
And how to allow WebEx Meet to take pictures and recent video while using the app only this time.
I would request everyone to please mute your mics.
Start my video.
Are you sharing the slides?
मैम मेरे को वही देखना है कि कैसे करना है.
How to find it here?
मैम ओपन आप अपना पीपीटी को ओपन कर दीजिए और शेयर जहाँ पे है उस पे क्लिक कीजिए उसको डेस्कटॉप से उठा लीजिए
volume you have
और
not.
I can also share it. You just mail it across to me.
All right, I'll do it.
Okay, you have chosen to connect any of the. Show me the list of available network. Connect to an available network. Click to see if the Wi-Fi is there. Network.
सर प्लीज अपना माइक म्यूट कर लीजिए सर A very warm welcome to all of you. On behalf of National Institute of Social Defense, I would like to welcome everyone who has joined us today. National Institute of Social Defense is the nodal institute under Ministry of Social Justice and Empowerment, Government of India. Our office is located at Sector 10, Dwarka, New Delhi. The institute is focused on building of human resource development in the areas of substance abuse prevention, care of senior citizens, and other social defense issues like beggary prevention and transgender issues. As all of you know that we have started with the online webinars these days. And today's topic of our discussion is constipation, acidity, and anemia in the elderly. And the resource person for today's webinar is Madam Tithi Prabhakar. Madam is holding for more than 15 years of work experience. She has an enriching and diverse experience in the field of diet, wellness, and nutrition. Apart from working as a dietitian in various hospitals and clinics, she has conducted several health education workshops and professional talks for a wide section of professionals. She has helped hundreds of clients discover healthy living through effective nutrition. Madam, we would like to welcome you for this session And before the session begins, we would like to inform you that we are sharing a form, registration form, a link in the chat box, and all of you have to submit before the training starts. And we would request everyone that the video of all the participants should be visible during the program. And participants can also use the chat function in the setting bars if they have any question during the course, or they can choose the raise hand option. Question and answer discussion round will be there to address the participants' query and doubts. In the last 15 minutes of the training, each participant should complete a feedback form, because your feedback is very, very important to keep on improving our sessions for the future also. So I would request Tithi ma'am, and it is an honor as well as a pleasure to welcome ma'am amongst us.
Thank you, Asha ma'am. Thank you so much. Am I audible?
Yes, ma'am, you are audible.
Okay. So thank you so much. And it is always a privilege to work with the NISD. And this is in continuation with all the other webinars that we have been doing for the elderly. And I would like to congratulate NISD for the amazing work that they are doing, because it is not easy to do work in such fields. And I know on a personal this thing experience the amount of hard work that they put in and the long hours. There is no Saturday, Sunday, just so that more and more people benefit from the webinars and from the other schemes, welfare schemes that are going on. So I would like to congratulate them for the amazing work that they are doing. So now we, in continuation with the webinars that we have been holding, so today's topic is constipation, anemia, and acidity in the elderly. So as you know that constipation is a very, very common problem, but acidity and anemia are also related, and they are like, a fallout of severe constipation that the elderly might have. So now I'll be sharing my screen and going on to the PPT.
I would request all the participants to please fill up the form, registration form.
So can everyone see the PPT? Can everyone see it? Is it visible?
Yes, ma'am. We have more than 52 participants, and we can go ahead, ma'am.
Yes, ma'am.
Okay. So now, first of all, I'd like to, tell everyone what exactly is constipation. So here on the right-hand side of the screen, we can see something called as the Bristol chart. So Bristol chart is basically so that, people who are not sure whether they have constipation or they have normal stool.
I'm seeing only good morning screen. Okay, now.
Now, can you see?
Yes, yes.
Yeah, now it is visible.
All right. So the right hand side of the screen is the Bristol chart. So which basically tells us whether a person, if they are not sure whether they have constipation or they just feel that they have constipation. So this is like a broad guideline for them to understand that. Now, what happens is that as we grow older in age, especially chronic constipation is very common in adults who are more than 60 years old. Now, what happens is that because the muscles or the pelvic muscles or the muscles which help in the elimination of the food from the stomach, they become very, very weak. So constipation can be, as we say, defined as saying that when there is incomplete elimination of stool, that means you may feel that you have not completely evacuated the stool. आपको लगता है कि नहीं अभी शायद मुझे और स्टूल पास करना है, सो दैट इज इनकम्प्लीट एलिमिनेशन. और अगर आपको डिफिकल्टी हो रही है स्टूल को पास करने में, दैट मीन्स यू हैव टू स्ट्रेन और यू हैव टू पुट सम प्रेशर और यू फील सर्टेन अमाउंट ऑफ पेन एंड डिस्कम्फर्ट जब आप स्टूल पास करते हैं. और इट मे बी इवन प्रेजेंट विद नॉर्मल स्टूल फ्रीक्वेंसी. दैट मीन्स कि आपका स्टूल नॉर्मल है, आपको कोई पेन या डिस्कम्फर्ट नहीं है, बट you do not go like what normally let's say once a day or twice a day you don't go, and you go less than 3 times in a week. Okay, so then that is also a form of constipation. Chronic constipation, like I said, बहुत ही common है in older people who are more than 60 years of age, because जो muscles है वो weak हो जाते हैं. The digestion becomes an issue, the digestive muscles become weak, so the food doesn't get processed properly. So जब आप खाना खाते हैं तो वो डाइजेस्ट नहीं होता, जब वो डाइजेस्ट नहीं होता तो उसका जो स्टूल का बल्क है वो फॉर्म नहीं होता, और जब बल्क फॉर्म नहीं होता तो फिर उसको एलिमिनेट करने में भी प्रॉब्लम आता है. ऑल्सो द एल्डरली, एज वी ऑल नो, also face a very common problem of dehydration. So when they are dehydrated, now they can be dehydrated because they are not drinking enough water, or the food that they are having does not have enough fiber, और they are dehydrated because they feel कि if I drink too much water तो मुझे फिर बहुत ज़्यादा वॉशरूम जाना पड़ेगा, यूरिन पास करना पड़ेगा, so they start drinking lesser and lesser water, and that also causes constipation. Now when you have constipation, but you're not sure, but you feel like a feeling of fullness, as if you are full all the time, you don't have too much of appetite, you eat very little and you feel कि no, I'm still full, I'm not hungry. और आपके स्टमक में ब्लोटिंग आपको लगती है, जो कि हम जिसको हम बोलते हैं पेट का फूल जाना, पेट फूल जाता है और आपके स्टमक में दर्द होता है, या आपकी जो एपिटाइट है वो धीरे धीरे बहुत कम हो जाती है, बिकॉज आपको हमेशा ऐसे लगता है कि मेरा पेट भरा हुआ है, आई एम नॉट हंग्री, मुझे भूख नहीं लग रही है. सो दैट कैन ऑल बी causes of constipation, और these are ways in which you can identify कि आपको constipation है भी या नहीं है. But it is very common in elderly people, and they are very simple and easy ways to reduce it and to get relief from constipation. Now we will look at the causes of constipation. Now in the previous slide you may have noticed that I have written primary and secondary constipation. Now what happens is primary constipation is basically which is because of dehydration or lack of fiber, etc. Whereas secondary constipation वो constipation होती है जो कि किसी और कारणवश आपको हुई है, for example medication से, or as a side effect of some other ailment that you have, or for example you are taking some treatment, or you are being given certain medication जिनका की side effect होता है constipation, which we will discuss in little detail in the subsequent slides. Now here we have the causes of constipation. Now a lot of people always wonder कि why I get constipated regularly, मेरा stomach clear क्यों नहीं होता है, मेरा bowel movement ठीक क्यों नहीं है, but they are never able to pinpoint कि किस कारणवश वो हो रहा है. So here I have listed a few of the very common reasons. There can be more reasons, they can be person specific reasons apart from these causes which can cause constipation. First of all, and the most common one, is a poor diet. A poor diet basically means a diet which is not balanced, a diet which does not have enough and more soluble and insoluble fiber, a diet which doesn't have balanced minerals and vitamins, diet which is only not made of fresh food, or which has covers only stale food, or which basically reheated food or ready-made food. So that is what we call as a poor diet. A diet which does not give you the nutrition that you require will classify as poor diet. Now a lot of times we see there is a ओवर यूज ऑफ कन्वीनियंस फूड। कन्वीनियंस फूड हैं जैसे ब्रेड, बिस्किट, नूडल्स, पास्ता। जो रेडीमेड फूड आइटम्स होते हैं उनको कन्वीनियंस फूड्स बोलते हैं, बिकॉज दे आर कन्वीनियंट, इजी टू यूज। उनको बनाना भी आसान है और उनको खाना भी आसान है, लेकिन उनके अंदर जो फाइबर की मात्रा होती है, क्वांटिटी ऑफ फाइबर इज मच मच लेस, and so they can cause constipation, they can cause other malnutrition problems, they can cause deficiencies, and so they also classify as poor diet. The second most common cause will be lack of adequate fluids in the diet. Now, for example, आपकी जो भी डाइट है वो बहुत ही ड्राई है, आपको सूपी या सिरपी या ग्रेवी वाला खाना पसंद नहीं है, सो आपकी डाइट में जो एडिक्वेट फ्लूइड्स हैं वो प्रेजेंट नहीं है, आपका वाटर इनटेक कम है, जूसेस and other beverages are much less, so then your diet becomes deficient in fluid content, और फ्लूइड कंटेंट कम होने से जो स्टूल फॉर्म होता है वो डिहाइड्रेटेड होता है, इट बिकम्स हार्ड and it becomes very difficult to expel from the body. So if your diet has adequate gravy or soft foods or certain vegetables like cucumber which have lot of water or fluid in them, or for example a vegetable like घिया और टिंडा, तोरी, इनमें अगर आप जब इनको हम कुक करते हैं तो हम देखते हैं ये बहुत ज्यादा वाटर रिलीज करते हैं। सो अगर इस टाइप के जो फूड आइटम्स हैं आप नहीं खाते, या जैसे मशरूम्स हैं वो नहीं खाते, वो भी बहुत पानी छोड़ते हैं, जो कोई भी हरे पत्ती वाली सब्जी होती है दे ऑल्सो व्हेन दे आर बीइंग कुक्ड दे रिलीज अ लॉट ऑफ फ्लूइड्स। सो इफ यू आर नॉट हैविंग these kind of food items, or you are not having enough of buttermilk or tea, coffee or water or juices or milk, then your diet becomes inadequate in fluids. तो उससे क्या होता है, आपका जो स्टूल का बल्क फॉर्म होता है उसमें पानी की कमी होती है, फ्लूइड की कमी होती है, and that is how your stool start becoming hard and cause you constipation. Now there can also be lack of exercise. Now, like I said, that it is a very common problem with the elderly. So they can be restricted in their movement. They can be having joint pain. They can be having knee pain. They may not. They may feel weak, or they may be on bedridden for some reason, or they may have had some surgery, and so they cannot move around. So this will all amount to lack of exercise. जब हम चलेंगे फिरेंगे नहीं, हम एक्सरसाइज नहीं करते हैं, तो हमारे जो मसल्स हैं, स्टमक के मसल्स हैं, पेरिस्टाल्टिक मूवमेंट वाले मसल्स हैं, वो सारे वीक हो जाते हैं, और वीक होने के बाद दे आर नॉट एबल टू clean the system, and the entire bowel is not clean, and the stool is not eliminated in one sitting. Next can be certain drugs, which are, like I said, it is one of the secondary causes of other medical conditions. जैसे certain antidepressant medications हैं, antacids जैसे इनो और जेलोसिल, इस टाइप की जो चीज़ें होती हैं, या सर्टन डायूरेटिक्स। डायूरेटिक्स वो होते हैं जो आपकी बॉडी में से एक्स्ट्रा पानी को एलिमिनेट करते हैं। यहाँ एंटी पार्किंसन के भी कुछ दवाइयाँ हैं जिनसे कि लोगों को constipation हो जाता है, because it is a direct side effect of the medication that they are taking. Poor bowel habits. Poor bowel habits के बहुत कारण हो सकते हैं. It can be like you get up very late, so you are not able to move around much before you need to go to the washroom. और आपका कोई फिक्स टाइम नहीं है वॉशरूम जाने का. कभी आप सुबह जाते हैं, कभी दोपहर में जाते हैं, कभी लंच के बाद जाते हैं, तो आपका कोई एक सेट पैटर्न नहीं है. अगर आप एक सेट पैटर्न में एक अप्रोक्सीमेटली सेम टाइम पे हर रोज जाएंगे, तो आपकी बॉडी उस टाइम पे, जिसको हम बोलते हैं मसल मेमोरी, वो क्रिएट करेगी, और आपको उसी टाइम पे हर रोज बाउल मूवमेंट का आपको फीलिंग आएगी, एंड यू कैन गो टू द वॉशरूम. So if you have poor bowel habits, or it can also be for certain people who are staying and sharing a washroom, then what happens, supposing you want to go to the washroom, you feel a certain sensation, you want to go, but the washroom is occupied. So then because of that they are not able to go to the washroom when they feel like going to the washroom. So all these can contribute to poor bowel habits. There can be a lack of interest in eating. Now there are certain people who because of their circumstances वो अकेले रह रहे हैं तो उन्हें ये लगता है कि अभी हाई फाइबर का खाना, वेजिटेबल्स, फ्रूट्स कौन लाएगा, कैसे बनाना होगा. सो व्हाट दे डू इज दे ईट इजी फूड्स, फॉर एग्जांपल bread or simple foods like which are low in fiber or which are processed like noodles or maggi or biscuits or rusk. So these food items, because they are not interested in eating or cooking or procuring the vegetables and fruits, what can happen is that these food items are very low in fiber. They are convenience foods. They are processed. They do not have any soluble or insoluble fiber in them. So these can also cause constipation if they are part of your regular diet. Loss of teeth. Loss of teeth is also a common cause because when some elder person doesn't have teeth or there are few teeth which are missing, then they are not able to chew salads, they're not able to chew raw vegetables, and not able to eat too many food items which need chewing. So what they do is they overcook them, they make them very soft, or they cut them in very small pieces, or they may even blend the food, so the fiber starts getting broken down. तो वो जो फाइबर है वो इतना ब्रेक डाउन हो जाता है या इतना सॉफ्ट हो जाता है कि वो बाद में जो स्टूल का बल्क है वो फॉर्म नहीं करता है. Also because of prolonged bed rest or they are bedridden, so there is no movement in the lower body, or they are not exercising or walking enough, or they're not able to eat too much food, or too much digestion is not there, then that can also lead to prolonged and chronic constipation. Now here in the next slide, we can see a few symptoms of constipation. So sometimes what can happen is that you are not able to understand कि मुझे constipation है या नहीं है. So here are few symptoms. If you see fresh specks of blood in the stool, or there is unexplained weight loss, there can be fever, because when you are not able to pass stool on a regular basis, then it can lead to accumulation of toxins, of gases, and it can cause nausea, it can cause vomiting because you feel full all the time. It can also, like I said, lead to loss of appetite because the earlier food item has not been digested and eliminated, so the stomach and the small and the large intestine may be holding some amount of stool, so you feel I am not hungry. There can also be a family history of inflammatory bowel disease. Now ये क्या होता है, supposing आपकी family में history है constipation की, या inflammation of the muscles or the intestine, or there is a history of some for example the way the digestion is, or there is a disease of the digestive system, then also you can have it can be one of the symptoms. Now supposing you are not sure whether you have constipation, because if you are having less than 3 bowel movements in a week, देन दैट इज वंस अ वीक आप जा रहे हैं, या सिर्फ मैक्सिमम 2 बार ही एक हफ्ते में जा रहे हैं, बट आपको लगता है कि लेकिन मैं हर हफ्ते ही 2 बार ही जाता हूँ, लेकिन इवन देन इट विल क्लासिफाई एज कॉन्स्टिपेशन. इफ यू feel that you have hard, dry or lumpy stools which are difficult to eliminate, or which give you pain or which give you discomfort. Also, if you after passing stool you still feel that I have not completely I'm not clean, my bowel is movement is incomplete, then also it is classified as it is one of the symptoms of constipation. Next is the treatment. Now this we have now understood what is constipation, वो किस कारण से होता है, क्या क्या उसके symptoms हैं जो जिससे कि हमें पता चलता है कि हमें constipation है भी या नहीं. Now the next slide tells us about the treatment. The first and foremost thing that we need to do is to restore the normal bowel habit. Okay, Now, for example, what is normal bowel habit? That is passing a stool which is soft, which in which you don't have to strain, in which you do not feel any pain, you do not feel any discomfort, and you go more than 3 times a week. Whenever you're passing stool, you get the clean feeling of empty bowels. You feel my body is clean. You feel कि मेरा पेट साफ हो गया है. Then that is a normal bowel movement, and that needs to be restored. Now you can do that with lot of medications, lot of tablets, lot of other things, but I will tell you in the next slide about the role of nutrition in the treatment. um, when we are treating constipation, after we have restored the normal bowel movement or the habit, that means going at the same time every day, try to go at least once a day to clean it, maintain regularity, and then we have to ensure that the stool is soft and that there is no stress and strain. We have to also see whether we can improve the quality of life with minimal side effects. That means if we can introduce small things, small changes in eating habits, small changes in lifestyle, small changes in activity, small changes in drinking water, and trying to find out the real cause of the constipation with minimal side effects. Sometimes what happens is that people get used to taking certain laxative, और जिसको हम बोलते हैं जैसे चूरन कोई खा रहे हैं, कैस्टर ऑयल कोई लोग पीते हैं, या बहुत ज्यादा इसबगोल खाते हैं एज अ रेगुलर पार्ट ऑफ their bowel movement. So these things over a period of time can cause lot of side effects. They can eliminate the friendly flora in your stomach. तो फिर उसके बाद आपको irritable bowel movement, irritable bowel syndrome, bloating, acidity, water retention, और भी बहुत सारे जो है मिनरल और विटामिन डेफिशिएंसीज भी हो सकते हैं. सो ऐसी चेंजेस से हमें उसको कॉन्स्टिपेशन को ट्रीट करना है जिससे कि हमारी बॉडी में और कोई साइड इफेक्ट्स ना हो. Small lifestyle changes like increasing the physical activity, eating a balanced diet, eating a nutritious diet, whether small in quantity, but it should be high in soluble as well as insoluble fiber. It should give you plenty of minerals and vitamins, and it should lead to soft stool formation which has bulk. Eating a balanced diet with fiber and fluids is not very difficult. Anyone can do it by making few small changes and also keeping a track of which change in the diet helped them the next day or the next to next day, and then continuing with that change. If you feel कि जब मैं सोने के पहले फॉर एग्जाम्पल आई टेक अ कप ऑफ मिल्क and next day I get a good bowel movement, that means that suits you, so you should continue with that. So you have to be very vigilant, you have to be alert, and you have to note down the small changes which help you in the long run. Now we go on to the role of nutrition. Now, the easiest way to deal with constipation, to give relief from constipation, is to do it in a nutritional way, to do it in the comfort of your own home, to use food as a medicine instead of actually eating medicine. So here are few ways in which we can relieve the constipation that we have, especially for the elderly, because they are already sometimes taking so many medicines that they do not want to take yet another medicine just to clear their bowel. Now, when the bowel is not clear, जब हम constipated हैं, it leads to lethargy. It can lead to a feeling of irritation. It can lead to other associated problems which we will discuss further, like acidity or anemia or a pain in the stomach. And basically, you do not feel relaxed, rested, and you have a lot of pain and sometimes lot of discomfort. So few ways in which you can use food as medicine, and you can use the nutrition of your home, of your kitchen, to give relief to the elderly, or even if any age person is having constipation problem, they can use these. First is to eat more fiber. This goes without saying because fiber ही आपके स्टूल को बल्क प्रोवाइड करता है, उसको सॉफ्टनेस प्रोवाइड करता है और उसकी मूवमेंट और इजी पैसेज में हेल्प करता है. Now, like I told you, there are two types of fiber. So both the type of fibers should be in good quantity, in good measure, in all the meals. Don't think कि अगर मैंने लंच में फाइबर खा लिया तो that will be enough to get a good bowel movement, या मैंने सिर्फ डिनर में खा लिया है तो it will be good enough. No, it has to be part of, in some way or the other, part of all your meals, and if possible in as part of your snack as well. So the total quantity of fiber, soluble and insoluble, जो आप खाते हैं उसका बहुत ज़रूरी है कि हम उसके ऊपर ध्यान दें कि हम कितना खा रहे हैं और हम उसको किन किन चीज़ों में इंक्लूड कर रहे हैं. इट इज़ वेरी इजी, आई विल बी डिस्कसिंग इट इन द नेक्स्ट स्लाइड, but eating more fiber will be the easiest way to do it. The next is tea, coffee, or any warm beverage. Warm beverage can be a cup of soup, it can be a glass of warm water, it can be a warm glass of milk, or it can be regular tea and coffee. So, lot of people, if you ask, they will say that if I have a hot cup of tea or coffee in the morning, I feel like going to the washroom immediately. So, जो टी एंड कॉफी है या मिल्क है या एनी वार्म बेवरेज, sometimes what it does is it stimulates the stomach because of the warmth and because of the certain minerals and vitamins which are present in them. So they will stimulate and they will initiate the bowel movement in a lot of people. So this is one of the easiest things you can do. Form a regular bowel habit which can include any warm beverage or tea or coffee. So that will stimulate and lead to a clean bowel movement. So like I said, you must always be aware of what works for you, what works for your body, and what can give you a clean bowel movement. If you're aware that this thing helps me or that helps me, then you should do it on a regular basis. The third one is drinking more water. Now, water, there cannot be enough said about the positive benefits of water, and it also helps in relieving constipation because it does not allow the stool to be dehydrated. It gives lets the stool be moist, and it doesn't allow there to be any pain or any discomfort. So if you drink enough water, तो जो आपने फाइबर खाया है उसके साथ वाटर मिक्स होके it will give you bulky stools which are easy to pass. So if you cannot drink plain water, you can have cinnamon water, you can have सौंफ का पानी, you can have जीरा पानी, अजवाइन. Hello? Ajwain pani. You can have all these different types of waters. So basically, you have to keep your body completely hydrated so that there is no dehydration of the stool, there is no dehydration in the intestines, and there is bulk in the stool. The next is a laxative. Now, lot of people take laxative, natural as well as chemical laxatives, and sometimes it does help them, but it should not be a regular practice. Probiotics. Probiotics is basically any fermented food which will increase the friendly bacteria in your stomach, in your gut. So it can be a small thing like a cup of fresh curd, it can be any fermented food, it can be things like you get these small fermented drinks like kombucha or Yakult, or it can even be like some salads, kimchi salad, and all these things also help to increase the friendly bacteria. When there is more bacteria in your stomach, that means the food will get digested properly, there will be bulk created, that bulk will lead to soft stools which will be able to be eliminated easily. Prunes and raisins, जिसको हम किशमिश बोलते हैं या मुनक्का बोलते हैं, Prunes are small plums which are now available in India also. So what you have to do is basically थोड़े से पानी में कुछ देर के लिए या ओवरनाइट उनको सोक करके आप उनको मॉर्निंग में ले सकते हैं. So they also have lot of iron in them, lot of minerals and vitamins in them, and they help to give bulk and stimulate bowel movement. Warm milk, I have seen with a lot of my patients. Warm milk just before going to bed is a very good laxative. It induces deep sleep, and it also helps in clearing the bowels the next morning. Another very common laxative, which is a natural laxative, which is used by a lot of people in India, is isabgol or psyllium husk. So again, there are ways to use it. Some people have it with water, some have it with milk, some have it even with curd. So like I said, you have to identify which method works for you, which food item works for you, and then you have to make it a regular part of your daily routine, daily diet, so that there is regular bowel movement, there is soft stool which gets formed, and there is cleaning of the bowel without any stress or strain. Also including healthy fats. Now what is healthy fats? Healthy fat is something like butter or ghee or coconut oil, avocado, walnuts. All these include healthy fats. You have to take them in a balanced quantity, and they also line the stomach, they line the intestines, and they help in easy elimination of the bowel. So all these things are available in your kitchen. It is food which will act as medicine to relieve you of constipation, because chronic constipation is very very discomforting, and it spoils the quality of life. So there are ways in which you can help yourself. So you can use any of these things, or all of them, or few of them, to get a regular healthy bowel movement. Now there are, like I said, types of fiber. One is insoluble and one is soluble. So insoluble fiber is that fiber which basically does not get digested in the system, and it just passes out through the stool. So for example, wheat bran or wheat atta, or vegetables like cauliflower or beans. If you have cut the stem of cauliflower or you have peeled beans, you will realize that there are some strings and some very hard to eat portions, right, in the stem of the cauliflower. So all these things contain insoluble fiber. That means it is part of the food, but it will not stay in the stomach. It will have to be eliminated by the body. So while it is getting eliminated, it carries the rest of the stool with it by increasing the bulk. So this is very helpful. Then whole grains, जैसे कि चना, राजमा, काला चना, all or any whole dal, they also have a certain amount of insoluble fiber in them. Then nuts, जैसे कि बादाम, walnuts, because of their shell, because of their covers, certain seeds, they also promote bulking of the stool. And potatoes. So a lot of people, they do not take out the skin of the potatoes, especially in the new potatoes, they do not take out the skin. So that also is like insoluble fiber, and it helps to give you a good bowel movement, and it increases the bulk of the stool. Now we come to the second type of fiber, which is the soluble fiber. So soluble fiber is basically the fiber which, when it dissolves in water, वो एक जेल या पेस्ट की टाइप का एक मटेरियल फॉर्म करता है. So what that paste does, it kinds of lines the stool. Okay, it is like a slippery lining to the stool, and helps in easy evacuation. So जैसे कि ओट्स ब्रांड, बार्ले बार्ले यानी जौ, कोई भी सिट्रस फ्रूट्स में आपने देखा है, उनमें जो जब हम उनको स्क्वीज करते हैं तो उसमें छोटे छोटे रेशे होते हैं, स्मॉल Or apples, if you have eaten with the skin, you will realize that there is a residue in your mouth. Then beans and lentils mane dal. So all of them form soluble fiber. So to get good fiber in your food, you must have a good mix of insoluble as well as soluble fiber. So make sure that even in your breakfast, your lunch, your dinner, soluble fiber जैसे दाल, राइस, वेजिटेबल्स, या व्हीट की रोटी, या होल ग्रेन्स ज़्यादा खाएं, ज़्यादा ये कॉलीफ्लावर, बीन्स और फाइब्रस वाली जो वेजिटेबल्स है उनको ज़्यादा खाएं। होल होल व्हीट वाली रोटी ज़्यादा खाएं। मैदे की रोटी में ब्रांड नहीं होता है और वो प्रोसेस्ड होती है, उसमें बहुत कम इनसॉल्युबल फाइबर होता है। रेगुलरली हैव नट्स जैसे कि आमंड्स, वॉलनट्स, पिस्ताशियो, raisins, all these things you should have regularly. Try to eat potato जिसका थोड़ा सा छिलका जो है वो बहुत ज़्यादा निकला नहीं हुआ है. So all these things will slowly create bulk and will help in easy bowel movement. Now, just to give you a very broad idea of which kind of foods are allowed in constipation, or which you should regularly on your own try to include in case you are not having them already, or you are starting to feel कि मुझे थोड़ा थोड़ा सा कुछ constipation का problem आ रहा है, then these are the food items that you can regularly include. High fiber fruits and vegetables and whole grains, like I said, जैसे चना हो गया, राजमा, मोठ, हरी मूंग की दाल या स्प्राउट्स, ये सब चीजें उनमें ज्यादा फाइबर होता है. फ्रूट्स जैसे कि बनाना गिव्स बल्क. सिट्रस फ्रूट्स, एप्पल्स, नाशपाती, पेयर, ripe papaya is very good for constipation. Ripe guava is very good for constipation. It helps to uh, gives you relief from constipation. Vegetables जैसे कि cauliflower, beans, तोरई, टिंडा, इनमें या कोई भी हरे पत्ते वाली सब्जी, मेथी, पालक, बथुआ, all of them have so much fiber in them. And when you are cooking them, you can use healthy fats like butter or ghee or coconut oil or grated coconut, and their fat content will also increase and will result in easy bowel movement the next day. डेयरी, नाउ डेयरी में जैसे मैंने बोला प्रोबायोटिक, अभी आप इसको छाछ भी पी सकते हैं, दही भी खा सकते हैं, और रात को सोने के पहले दूध भी ले सकते हैं, तो दिस विल बी वेरी हेल्पफुल. बट फॉर सम पीपल द मोमेंट इफ दे आर एलर्जिक टू डेयरी, जैसे ही वो दूध पीते हैं उनको कॉन्स्टिपेशन हो जाती है. सो यू हैव टू कीप अ लुकआउट के ऐसा नहीं होना चाहिए. यू इट दीज फूड आइटम्स शुड बी सूटिंग यू. uh, Regular use of butter and ghee. If you feel that earlier you were not constipated, now you have started getting constipated, then instead of taking some medication or laxative, it is better to start including some amount of pure butter, some amount of pure ghee in the diet rather than having a medicine. Coconut oil, a lot of people feel a lot of relief from constipation if they take a small cup of warm water और उसमें हाफ टी स्पून टू 1 टीस्पून कोल्ड प्रेस कोकोनट ऑयल अगर वो डाल के पीते हैं फर्स्ट थिंग इन द मॉर्निंग, so it lines your stomach and it results in easy bowel movement. So pure coconut oil, butter, ghee, all these if taken in the correct quantity are also very good. Now, here are certain food items that if you feel you're constipated or if you know someone who's constipated, then they should avoid these foods. First is excessive tea and coffee. Now, earlier we said कि tea and coffee पीना है, अब हम कह रहे हैं excessive tea and coffee नहीं पीना है. So there is a limit to what you can have in these kind of ailments. Excessive tea and coffee means more than 5 to 6 cup of tea or coffee in a day. What that does is that coffee and tea are basically diuretics. That means आपके body में जितना extra पानी होगा वो उसको eliminate कर देते हैं. So when all the extra water in your body goes away, then your stool start getting dehydrated, and there is dehydration in the intestine. In the bowel movement you will feel lot of tightness and you can experience pain while eliminating the stool. So have in a good limit, but do not exceed that. Alcohol also does the exact same thing. It causes dehydration. So if you take excessive amounts of alcohol, it can lead to dehydration, which in turn directly leads to constipation. Having too much of processed foods. प्रोसेस्ड फूड्स जैसे मैंने बताया, पास्ता, नूडल्स, मैदे से बने हुए आइटम्स, बन्स, ब्रेड, बेकरी आइटम्स, अगर ये आप ज़्यादा लेंगे तो उस मील में आपका जो फाइबर का कंटेंट है वो कम हो जाएगा. और अगर आप ये रेगुलरली अपनी डाइट में लेते हैं, दैट मीन्स आपकी डाइट में जो है फाइबर है उसकी कमी हो जाएगी. कमी होने से देयर विल बी लेस बल्क इन द स्टूल, and so it will be causing you constipation. Like I said, some people may be allergic to cow's milk or normal, maybe lactose intolerant, so they can feel constipation when they take dairy products, so they should avoid that. Red meat means too much of non-veg food. Now, as we know, meat is very difficult to digest. So, for the elderly people, when digestion is already getting affected, if they eat too much of red meat, which is difficult to digest, so it keeps sitting in the stomach. It does not get processed, it does not get eliminated, and it leads to constipation. So, for a lot of people, the moment they have meat or any non-veg item, then they feel lot of constipation. So if they want to have this, they should reduce the quantity, combine it with vegetables and healthy fats, and only then have that. फैटी एंड लो फाइबर फूड्स. सो ये फैटी फूड्स में कुछ भी फ्राइड आइटम है, जैसे नमकीन, पूरी, भटूरा और एनी अदर fried item which is heavily fried, because mostly all fried items are made from maida or processed flour, so their fiber is very low and they cause constipation, because again fried foods are very very difficult to digest for the elderly. So since they don't get digested in time, they don't form stools in time, and then they get constipated. Last of all is fast food. So now this is very common, like pizzas, burgers, noodles, pasta. So all these have again इनमें फाइबर कम होता है, ये प्रोसेस्ड होते हैं, they become very heavy, the body is not able to digest, they just keep sitting in the stomach. So a lot of people, if they keep having normal घर का खाना, दाल चावल खिचड़ी रोटी, they don't get constipated. पर जैसे ही वो बाहर का खाना खाते हैं तो वो सोचते हैं कि अगर हम बाहर का खाना खाते हैं तो हमें कॉन्स्टिपेशन क्यों होती है. वो इसलिए होती है क्योंकि उसमें फाइबर नहीं है, वो डिफिकल्ट टू डाइजेस्ट होता है, वो ऑलरेडी प्रोसेस्ड होता है, उसमें केमिकल्स, प्रेजर्वेटिव्स एडेड होते हैं, और आपका जो स्टमक है वो उसको डाइजेस्ट नहीं कर पाता है. जब वो उसको डाइजेस्ट नहीं कर पाता है तो वो स्टूल नहीं फॉर्म होता है, स्टूल नहीं फॉर्म होता है तो आपको कॉन्स्टिपेशन हो जाता है. So one has to be very vigilant about these things. Now, supposing you are plagued with chronic constipation, that means you've had it for a few months or a few years, or you have always had constipation. One of the direct side effects of being regularly constipated is acidity. So basically, acidity happens in lot of people who are constipated because, like I said, the food in their stomach does not get digested. When it doesn't get digested, it doesn't get eliminated from the body. And when it doesn't get eliminated and it keeps sitting in the stomach, then it keeps on getting rots in the stomach, और उसमें गैस फॉर्मेशन, उसमें एक्सेसिव एसिड प्रोडक्शन वो होने लग जाता है. जब एक्सेसिव एसिड प्रोड्यूस होता है तो यहाँ पे आप डायग्राम में देखेंगे, एसिड रिफ्लक्स में जो स्फिंक्टर है, जो वॉल्व है, वो धीरे धीरे डैमेज होने लग जाता है बिकॉज ऑफ एक्सेसिव एसिड, और वो डैमेज होके वो खुल जाता है. खुलने से वो आपके फूड पाइप में, आपके माउथ में अल्सर्स, टंग पे अल्सर्स, चेस्ट में हार्ट बर्न, और ये सब क्रिएट करता है. सो बट फॉर पीपल हु हैव अ रेगुलर एंड क्लीन बाउल, they very very seldom have acidity. लेकिन जो लोग रेगुलरली कॉन्स्टिपेटेड रहते हैं उनको ऑफ एंड ऑन एसिडिटी का प्रॉब्लम रहता है, बिकॉज इट इज समवेयर रिलेटेड विद कॉन्स्टिपेशन. सो दिस इज वेरी कॉमन इन द एल्डरली, बिकॉज उनकी डाइजेशन जो है, बिकॉज ऑफ वीक मसल्स, बिकॉज ऑफ मेडिकेशन, बिकॉज ऑफ लेस एक्टिविटी, उनकी जो डाइजेशन है वो अफेक्टेड होती है, इसलिए उनको कॉन्स्टिपेशन, उसके साथ रिलेटेड एसिडिटी रेगुलरली उनको प्रॉब्लम होता है इसका. अगर उनका कॉन्स्टिपेशन क्लियर हो जाए या रिलीव हो जाए कॉन्स्टिपेशन, तो आप देखेंगे कि उनका जो एसिडिटी का प्रॉब्लम है वो भी धीरे 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 कम हो जाएगा और उनको उसमें काफी रिलीफ लगेगा. सो जैसे टेकिंग प्रोबायोटिक्स, इंक्रीजिंग योर एक्सरसाइज, इंक्रीजिंग वाटर कंटेंट, ईटिंग हेल्दी फूड्स, फ्रेश फूड, नो स्टेल फूड, फ्रेश फूड, उससे आपका जो स्टमक में जो डाइजेशन है वो ठीक हो जाएगा और वो होने से आपको एसिडिटी कम हो जाएगी, एसिड कम प्रोड्यूस होगा. कम प्रोड्यूस होगा तो ऊपर गले में और चेस्ट में और माउथ में कम आएगा एंड यू विल फील रिलीफ. लॉट ऑफ पीपल they smoke. So smoking also induces acidity in a lot of people because it is heat producing for the body, and it is one of the side effects. Sometimes when you have a large or a late night meal, so ये it is very common if you go out for dinner और यहाँ आप किसी शादी में जाते हैं or a wedding or any other social engagement, so your dinner gets delayed. So you have a large heavy meal. Large meal means you eat more quantity. जो आप normally खाते हैं उससे आप ज़्यादा खाते हैं, या वो fried है, वो fatty food है, वो processed food है, उसमें जैसे red meat है या cream, butter, cheese, ये सब ज़्यादा है. So your body is not able to digest that, or it is very late at night and आप खाते हैं और immediately you start lying down in your bed to sleep. So the body is not able to digest that food. Then also it can lead to acidity and constipation the next day. Lot of people who have chronic constipation, they are not able to eat too much food at one time, but the body continues to make lot of acid, expecting lot of food, but they eat very, तो वो जो acid ऊपर आने लगता है. Spicy food also can cause acidity, and drinking too much coffee or alcohol is also one of the reasons why people get acidity. So, the first step is to have a clean bowel movement, to clean your stomach, to clean the intestinal area so that there is no food in that. The body is working properly, the digestion is good, and which will lead to decreasing in acidity and also other food again as medicine, and we'll discuss the role of nutrition in acidity. Now if you eat balanced meals, मतलब उसमें fruits भी है, vegetables भी है, whole है, फ्लूइड इनटेक भी है आपका, वाटर है, और फ्रेश फूड आप खा रहे हैं, बैलेंस्ड मील्स खा रहे हैं, सो यू विल सी कि धीरे धीरे आपकी जो कॉन्स्टिपेशन या एसिडिटी, इसकी जो प्रॉब्लम है वो धीरे धीरे कम हो जाएगी. बट इट टेक्स टाइम, एंड इट ऑल्सो डजंट मीन कि इफ यू हैव वन बैलेंस मील तो हमेशा के लिए वो प्रॉब्लम ठीक हो जाएगी. यू हैव टू मेक इट अ रेगुलर हैबिट. All your meals should be balanced, all your food items should be balanced, and it should be a regular practice. तो ऐसा नहीं है कि मैं एक हफ्ते से बैलेंस मील खा रहा हूँ तो अब मेरी कॉन्स्टिपेशन ठीक क्यों नहीं हुई. इट टेक्स टाइम फॉर द बॉडी टू रिएक्ट, इट टेक्स टाइम फॉर द बॉडी टू accumulate and absorb the minerals and vitamins and to respond. And if you are uh, more than 60 years of age or more than 70 years of age, then it takes you a little more time than that also. So if you're eating non-veg, ensure that you have some amount of vegetables with it. If you're having dry food items, ensure that you drink enough and more water. If you're having lot of raw fruits and vegetables, ensure that you have some amount of cooked fiber also, like rice or brown rice or oats or wheat roti or dal, like that. So ensure that it's balanced. If you're having some amount of biscuit or bread once in a while, ensure that you have enough fruits also, and always have fruits which are in season and which are ripe. Never try to eat too much of raw fruits, because they still need to be become ripe and give you the all the minerals and vitamins. So ripe fruits are the best, and also they should be in season so that they can give you the maximum amount of nutrition. Relief from constipation, like I said, that to some extent, if you are severely constipated, it will lead to heartburn, it will lead to acidity. तो अगर आपकी कॉन्स्टिपेशन से आपको रिलीफ मिल जाता है, तो आप देखेंगे कि आपको धीरे धीरे आपकी एसिडिटी की प्रॉब्लम भी खत्म हो जाएगी, हार्ट बर्न, चेस्ट पेन, और जैसे किसी को मुंह में छाले पड़ जाते हैं, अल्सर्स हो जाते हैं, माउथ अल्सर्स, वो भी उनको, उसमें भी उनको रिलीफ लगेगा. A lot of water. Now, water will help in reducing the discomfort from acidity as well as from constipation. So, if there is a burning sensation, you can have cool water. You can reduce the temperature of your stomach. You will feel relief. So, have a lot of water, a minimum of 8 to 10 glasses per person per day. Aloe vera juice, pure aloe vera juice is also very very helpful in reducing acidity, and because it has soluble fiber in it, it also helps to relieve constipation. So you can try to take 30 ml of pure aloe vera juice with 30 ml of water first thing in the morning, on an empty stomach, and slowly you will see that it helps to relieve the constipation, also reduces acidity, and makes your body very cool. Soluble fiber, like I said, fruits, vegetables, ripe fruits, and in season vegetables, these dals, they are all very helpful. Another very important thing that we see nowadays is that people eat in front of the TV, especially their dinner or their lunch. And as soon as they finish their meal, they lie down, they take rest. Don't do that. Give a gap of at least half an hour to 40 minutes before you lie down. You can sit, you can walk around, you can clear the kitchen, or you can take an after dinner stroll. ये सब चीज़ें हेल्प करेंगी कि आपके बॉडी में जो आपने मील खाया वो जल्दी डाइजेस्ट हो जाए, और जो आपका एसिड है वो आपके मुंह में नहीं आए, आपकी फूड पाइप में नहीं आए. So there should be a minimum of 30 to 40 minute gap after both your meals, and avoid spicy food. Now, if we talk about Ayurveda, then there are three types of bodies: Vat, Pitta, and Kapha. So, if you have a Pitta constitution, that means you already have a body which is very heat producing, then you will see that the spicy food will not agree with your body. You must always listen to the signs that the body gives you. You must also always listen to the pain it gives you. Try to find out the reason, try to connect the dots, and you will see that if you have a pitta body, you will not be able to have too much spice or heat producing food. So listen to that. Do not give in to the pleasures of the tongue and think, I like it, so I have to eat it. But if your body is rejecting that food item, you must not have that. So eating spicy food for certain people can trigger lifelong acidity. Now we come to the second disorder, which is also related to constipation in a very small way. That means if there is someone, the elderly, they are constipated or they have chronic constipation for a long time, then it causes piles, or it causes hemorrhoids, or it causes fissures. So there can be lot of blood loss in piles or hemorrhoids while the stool is being passed. That can lead to anemia. Blood loss hai. Sometimes the old people, they are not even aware that they are losing blood in their stool, or there is bleeding from the rectum, and that can cause anemia. So how we can come to know that whether that they have anemia or they're losing blood is they will feel lot of fatigue, they may feel lot of weakness, shortness of breath. That means their hemoglobin level has gone down. So as a ballpark figure, for men it is minimum should be 13 hemoglobin, and for women it should be 12. Or they feel high heart rate, or they feel certain headaches on a regular basis, or they look pale in their eyes. If you see the color of the eyes, it starts looking pale, or they feel low blood pressure at many times. That means that there is some amount of bleeding because of the constipation, maybe because of the piles, or maybe because of the fissures, and they are not aware of it. So this can also cause anemia. So we have to be very careful. These are the ways in which we can make out के कहीं अनीमिक तो नहीं हो गए, कहीं ज्यादा ब्लड लॉस तो नहीं हो गया, या स्टूल पास करते हुए बहुत ज्यादा ब्लीडिंग तो नहीं है. So then we can take the corrective measures. Now there can be some, broadly I am touching on the topic of anemia in the elderly. Apart from piles and fissures, it could also be because of malnutrition. Like I said, they are eating too little because of the constipation, or they're having too much acidity, or they are always feeling full, so they can get malnutrition. और बिकॉज देर इज अ डाइजेस्टिव डिसऑर्डर, तो उनके पेट में वो जो खाना है वो ठीक से अब्जॉर्ब नहीं हो रहा, डाइजेस्ट नहीं हो रहा, पच नहीं रहा है उनको, तो उससे उनको डेफिशिएंसीज हो सकती हैं, उनको मिनरल्स की, वाइटामिन्स की, आयरन अब्जॉर्प्शन नहीं हो रही है बॉडी में, उससे वो एनीमिक हो सकते हैं. और कभी कभी क्या होता है कि उनके गैस्ट्रो इंटेस्टाइनल ट्रैक्ट में कोई प्रॉब्लम है, कोई जैसे प्रोसेस नहीं हो पा रहा है, या उनको इरिटेबल बाउल सिंड्रोम है, तो उससे भी वो जो खाना है वो जितना उसको उनको न्यूट्रिशन देना चाहिए वो उनको नहीं दे पाता है, इसलिए भी उनको ये अनीमिक हो जाते हैं, उनका हेमोग्लोबिन कम हो सकता है, और उनको ये सारी रिलेटेड प्रॉब्लम्स हो सकती हैं. So this was my talk on constipation and the two related problems of anemia and acidity. I hope that it has been uh, useful and helpful for everyone. So
Thank
if
you,
there are
Sangeeta.
any questions, I can
Can I,
answer them now.
can I take questions, madam?
Yes, yes, please.
Yes, sir. Yes, sir.
See, I have got two questions. One is that you told about the cauliflower.
Yes.
Cauliflower, I heard and I felt that cauliflower gives you more gastric compared to other green vegetables. That is question number one. Second is the hemoglobin. In spite of
It's
taking
not
all this
audible.
kind of care, I find, in my case, I find that my hemoglobin never goes beyond 10.
So, sir, first I'll answer cauliflower. Now, like I said, that for certain people, it may not be agreeing with their body.
Okay.
It may be gassy for you. So that means you should not have it on a regular basis. You should avoid it. Or if you're fond of cauliflower, then and you feel it causes gas to you, then certain things like ajwain while cooking the cauliflower, you can add that.
Yeah, I like
Um,
cauliflower.
yes, so you can add ajwain to the cauliflower when you're cooking it, or you can add hing,
Okay.
asafoetida. While you are cooking the cauliflower, you should add that, and you will see a big difference. Hing and ajwain is very good. It will, yes. To
Okay.
answer the second question of hemoglobin, now first of all what happens is either some medication, like there are certain BP medications, certain other medications, they could be inducing anemia, or you can do take some specific iron tablets. But lot of
Greece.
time what people do, they take iron tablets or an iron course for 1 month or 2 months, and then they leave it and they again get anemic because your iron stores are depleted. it takes about 7 to 8 months
No,
to make
you are
up.
right. You are right, madam. What I have noticed is that the moment your iron level goes down, your hemoglobin goes down.
Yes,
That I've noticed. Now
yes,
I've also noticed that if I start taking pomegranate juices every day for a 1 month, my hemoglobin goes from 10 to 12.
yes.
So,
That
so what
means
should
your
be the regular?
stores
What should be
are.
the, okay? What should be the regular thing in iron in case of supplements? I should
Even
be considering.
grains, I think so.
Huh?
So, what your if you feel that pomegranate juice suits you, then you should continue with that. Like I was saying, that it takes about 7 to 8 months for you to make up for the iron deficiency. It is not a one month or a 2 month thing. You should take it for a minimum of 7 to 8 months. Another thing that is very useful and has long lasting results in iron or hemoglobin is beetroot. So you
Oh, that's good.
beetroot and any red yellow fruit and vegetable. So for example, you are taking beetroot and you don't feel like chewing it and you find it hard to digest or chew, then you can just make a beetroot soup every day, or let's say 4 days a week. But you can add tomato to it, you can add carrot to it, and you can add yellow pumpkin to it. Yellow pumpkin, kaddu.
Yeah, I know.
Okay, small pieces of that. Add 1 cup of water and a pinch of salt if you're not hypertensive, and just steam it and take out the clear liquid and have that. But before you drink, you must add a few drops of lemon juice to it. Even when you're having the pomegranate juice, try to squeeze in few drops of lemon. Lemon helps in the absorption of iron. You are
Yes, very
having,
good.
yes,
Very good.
if you are having any green vegetable, any green leafy vegetable, any green beans, cauliflower, any vegetable, squeeze a little lemon on it, and you will see that the absorption level of iron will go up and you will be able to maintain your iron stores.
So very good. Thanks for a very good advice.
Thank you.
I love all these foods.
Anyone else wants to?
Hello.
Yes.
Yes, ma'am. I have a question.
Yes.
Ma'am, if we use cooked food again and again, does it affect our digestive system?
Yes, absolutely. So, Poonam, like I always say in all my webinars, never have stale food. It is better to eat a simple khichdi or have 2 fruits and a cup of milk than to eat food which was made in the morning and then have it at night, because after about an hour or so, the nutrition in the food is almost negligible. It is zero. Okay, it doesn't give you too much nutrition, and because you are reheating it, it doesn't have any nutrition, it doesn't have, the fiber is soft, so it can help in the interfere in the digestive process. So always try to eat fresh and simple food, just dal and rice, but it should be cooked just before
Fresh.
fresh. And
Yes,
yes,
ma'am.
and avoid reheating the food because it creates a lot of toxins, it becomes difficult to digest, and it has almost zero nutrition. It is like eating cardboard.
Okay, ma'am. And one more thing, like हम कभी कभी आटा गूंद के रख देते हैं for 2 times. So is it also bad?
If you can avoid it, then there is nothing like that,
Hello.
but nothing like it. But or you can keep it in an airtight container so that it doesn't get oxidized, but best would be to make it fresh.
Okay. Okay, ma'am. One more thing, like I have a pitta type body. So in my
Yes.
case, what are the things that I should avoid apart from spicy and oily food?
So any heat producing food, जैसे
Ma'am,
जिससे भी हमारी,
like dry fruits.
like dry fruits, like mustard oil, like jaggery, mango, like spices, chilies, all these are heat producing. but I am not an expert in Ayurveda. So if you want any further clarifications or you want any details, then you should seek a Ayurveda practitioner.
Okay, and ma'am, I have iron deficiency, so can I go for the beetroot and
Yes,
pomegranate juice?
absolutely, absolutely. And four things, you should make it a habit to add four things to the beetroot juice. One is beetroot,
Yes, ma'am.
carrot,
Okay.
tomato,
Okay.
and yellow pumpkin.
Yellow pumpkin.
Okay, so you
Right.
can chop them or grate them together, add a cup of water,
Okay.
and 4 5 whistles to the cooker, right? And then जो उसका clear liquid निकलेगा, उसमें थोड़ा सा लेमन स्क्वीज करके आप वो ले सकते हैं. अगर आपको फाइबर के साथ खाना है तो आप वो पूरा खा सकते हैं. However you are comfortable, but lemon is
How much water?
must. However many people are having, if one person is having, then 1 cup. If two are having, then 2 cups. So 1 cup of water per person.
Will it
Okay.
dissolve?
Thank you so much, ma'am.
Excuse me, I got a doubt.
Yes, sir.
In spite of good bowel movements, endoscopy showed that I am having dyspepsia. I don't know what should I do. Or I got a lot of itching in the stomach. What-
Sir, I cannot hear you much.
Yeah, I have a itching problem on throughout my body. Due to
Okay.
the endoscopy showed that there is a dyspepsia in my stomach. So, what sort of food I should avoid to stop this itching sensation always?
So,
All over.
sir, are you on any other medication also?
I'm having a Levipil 500 for my seizure when I had a seizure. That I am having every day 500 Levipil 500 twice. And I am having I had a stent operation for my heart. So they have given me Losar and other.
Sir, how much water do you have in a day?
I really take about 6 to 8 glasses of water.
6 to 8?
Glasses of water and warm water.
Sir, can you avoid warm water?
I see. But in winter season, I cannot avoid. I cannot take it.
Sir, can you speak little loudly?
I am not able to take cold water in the winter season.
No, not cold water. Normal room temperature water.
Lukewarm water I am taking.
Room temperature.
Yeah.
Room temperature water.
Oh,
Don't heat
okay.
the water.
I see.
Room temperature water, minimum of 8 glasses, minimum of 8 to 10. Are you staying in a warm area?
No, not so warm area. Now I was in Chennai, but I have come over here by Bangalore for the past
Yes,
6
sir.
months.
Sir, it is warm. It is not like North India. It comes in the warm.
Bangalore, I am in Bangalore.
Yes, sir. So minimum of 8 to 10 glasses of water, and you can try to have fluids. You can try a glass of coconut water every day. That should make a difference. Sometimes that means you may be getting dehydrated, or the body may be losing salt, and so the itching may be there. So you have to try all these things. A glass of coconut water, increase your water content, try to have normal room temperature water, and you can try to have uh, uh, half a teaspoon of pure ghee in a small cup of milk before going to bed.
I see. In the overnight.
That will help you in your fissures. That will help you in the itching in the body. It will give certain natural lubrication to the joints, and that should help you. So you can try all these three things.
Should I avoid brinjal and other fruits like this yam, other varieties like potato and all that?
If
Should
you
I
feel they don't, if you feel they don't suit you, then you should avoid.
Because I had some grunting sounds from the stomach, so I was a bit worried whether these medicines like this, maybe that causes such medicine side effects. Levipil 500 and all that.
Sir, first you try the other three things, and
Yes.
then you go on an eliminating diet. First of all, you should do an additive diet.
I see. Thank you so
Okay.
much.
Hello.
Most welcome.
Hello.
Yes, sir.
Hello, madam. I am Purushottam from Karnataka.
Yes.
I have one question, madam. I have a gastric problem from almost 3 to 4 years. So I burp a lot during taking food. I don't know the reason. I will take sufficient food during morning and afternoon, but I am not able to take lot of food during night. I don't know the reason, madam. Please give a suggestion.
Sir, do you have lot of gap between your meals?
No, madam. I will take food at regular intervals, but I burp a lot during a
You
food
eat very
taking.
fast?
No, madam. I will take eat one slowly, madam.
And how many
I
times
eat
do you chew your food?
almost 30 times per
Okay.
bite.
Okay. So is the food fresh that you are eating? All
Yes,
these
madam.
all
It
these
is
are
fresh.
okay. I think if the time gap between your two meals is more than 2 hours, it can cause burping. If you eat very fast, that also cause. If you gulp your food, or if you don't eat enough food, then also if the quantity is very less, or if there is food which causes gas, like certain types of dals, or like one gentleman was mentioning cauliflower. If you are eating these kind of foods also, it can cause burping.
Whether there is any home remedies is there, madam, for controlling burping?
Hing is there. Hing, you know what is hing? Asafoetida.
Asafoetida, yes.
Yes, so you must add hing to all your meals, like dal also and all the vegetables also, and try to keep the gap between the two meals a little less, and try to eat slowly.
Okay, okay.
Small bites,
Hello?
slowly chew it properly, and also ajwain after your meal, after 10-15 minutes, you can take half a teaspoon ajwain with 2 sips of warm water. That will also help with the burping.
Okay, thank you, madam. Thank you.
Welcome.
Hello,
Ma-
madam.
Madam, one question.
Hello.
Yes.
I am T.R.V. Bhatt from Bangalore speaking.
Yes.
Are you able to hear me?
Yes.
See, I am from Bangalore, and the
Yes.
weather is always cool here,
Yes.
so we don't sweat much.
Okay.
And in the lecture, I hear you give importance to ghee and other things, but I've been avoiding ghee and potato all these years,
Okay.
and it has not led to a severe constipation, but at times I do have the symptoms.
Okay.
So should I continue with? I am a regular dal roti man
Okay.
with morning and night one vegetable.
Okay.
In between, I take one or two fruits,
Okay.
and 2-3 cups of coffee I take.
Okay.
And because of Corona, I was not able to walk. Also in the walk, I could not take much walking.
Okay.
So in the house, I do some exercise and all those things.
Yes, sir.
So, should I continue that type of taking ghee and all those things?
Yes, sir. You should try to include more ghee, because what happens is, like I said, maybe it is because the digestive muscles have become a little weak because you're not able to do your walking. So either you can
I
start
see.
your walking a little bit, even if it is walking inside the house after your meals.
Yes, that we do in the terrace. We walk.
Yes, sir. So you can add a little pure ghee to the roti, or in the vegetable. If
Okay.
not every day, at least once or twice a week.
Okay. And which vegetables I should avoid particularly? They say I should not take potato.
Sir, because potato has a little less fiber, but it's not like that. You can have any green leafy vegetable. You can have beans and peas. All the vegetables you can have. The fibrous the
Okay.
vegetable, the better it is.
Thank you. And can I
Madam,
add
one
honey
last question.
in my
One last question.
honey?
Yes, sir.
Honey.
Can I add honey in the milk?
Yes, yes, you can add honey. Yes.
Madam, one last question.
Yes, sir.
See, I'm told that people having diabetes, because of sugar, should avoid taking coconut water. Is it true?
No, sir. No, it's not true. You can have coconut water. It helps to balance your sodium and potassium. It is very good for people suffering from high BP, and it provides a lot of minerals and essential salts to the body. And it is
That is,
one of a good fluids to take, especially if you face acidity or constipation.
thank you. Thank you.
Hello.
Just wanted to know, you said with milk, I have to add ghee in that or coconut oil? My
Ghee, ma'am,
constipation
you can
problem.
add
Ghee, you mean?
you can add half a teaspoon or 1 teaspoon of pure ghee. You can add a pinch of black pepper. You can add a pinch of pure haldi to it before going to bed.
Okay, thank you. Thank you.
Hello. Hello, ma'am. Hello.
Yes. Yes.
Hello, ma'am. एक्चुअली मैम
Yes.
मुझे क्रॉनिक कॉन्स्टिपेशन है और मेरे हस्बैंड को भी कॉन्स्टिपेशन और एसिडिटी है और हमें मेरे हस्बैंड हमेशा वार्म वाटर ही पीते हैं, पूरा 2 साल से गर्म पानी पी रहे हैं। उनको
Yes.
बहुत ज्यादा एसिडिटी भी रहती है और
हाँ,
हम लोग मॉर्निंग में मैडम हमारा डाइट जैसे है कि हम लोग सुबह में वेजिटेबल जूस पीते हैं और उसके 1 घंटे के बाद लाइक ड्राई फ्रूट्स का मिल्क शेक पीते हैं। इज इट ओके दिस फूड मैम?
This is okay. It seems okay, but try to have at least once or twice in a week. आप जैसे ओट्स का दलिया या जो रागी दलिया या वीट का दलिया, उसमें थोड़ा सा फ्रूट्स डाल के खाएं, जैसे कि बनाना, एप्पल, थोड़ा सा सीड्स को स्प्रिंकल करके उसके ऊपर खाएं. सो दैट विल गिव बल्क टू द स्टूल.
अच्छा, और मैडम नाइट में हम लोग लाइक दूध के साथ खसखस और मखाने और ये घी डाल के पीते हैं मैम रात को उबाल के। इज इट
अच्छा.
ओके?
No, it is okay, but is it helping you in some way?
पता नहीं मैम, थोड़ा कॉन्स्टिपेशन तो है ही मेरा और पेट भरा भरा रहता है, भूख नहीं
हाँ,
लगती।
क्योंकि आपका आप जो खाना बता रहे हैं ये बहुत हेवी फूड है. जैसे अगर आप दूध में ड्राई फ्रूट्स और ये सब डाल के खाएंगे, इट बिकम्स वेरी हेवी. सो यू शुड स्पेस इट आउट. या फिर अगर आप दूध में ड्राई फ्रूट्स डाल रहे हैं तो जो ड्राई फ्रूट की क्वांटिटी है वो हिसाब से होनी चाहिए. ऐसा नहीं कि एक कटोरी भर के ड्राई फ्रूट खा रहे हो तो इट बिकम्स वेरी डिफिकल्ट फॉर द बॉडी टू डाइजेस्ट. सो मे बी जैसे 3-4 आमंड्स, 5-6 रेजिन्स, बस इतना.
अच्छा, एक जन के लिए?
एक जने के लिए. और सेम वे मखाने और खसखस और ये सब जो है वो दूध उससे हेवी हो जाता है. और अगर आप फुल क्रीम वाला दूध ले रहे हैं देन इट बिकम्स वेरी डिफिकल्ट फॉर द बॉडी टू डाइजेस्ट. सो
नहीं,
यू
टोन
शुड.
ले रहे मैम।
ठीक है, तो ये थोड़ा सा आप हेवी हो रहा है आपका खाना. इसकी जगह पे आप नॉर्मल एक दिन प्लेन मिल्क एक दिन ले लो, एक दिन थोड़ा सा घी डाल के दूध ले लो, फिर एक दिन ये वाला थोड़ा कम ड्राई फ्रूट वाला दूध डाल के ले लो. ठीक है, फिर एक दिन स्किप कर दो. सो
अच्छा,
यू
डेली
हैव टू गिव, हाँ, यू हैव टू गिव रेस्ट टू योर बॉडी.
ड्राई फ्रूट्स का पी रहे मैम, वो डेली नहीं लेना है?
वो डेली मत लीजिए, 2 बारी हफ्ते में बहुत है. 2 या मैक्सिमम 3 बारी. और बाकी
10
टाइम
से
आप
12 ड्राई फ्रूट्स की टाइप, 10 से 12 टाइप्स ऑफ ड्राई फ्रूट्स वी पुट इन दैट एंड one banana, so much it becomes like 1.5 glass we drink in the morning ma'am.
Yes, so it is becoming difficult for your body to digest it.
Not to drink daily.
Either you reduce the quantity or you reduce the dry fruits, and once a week you have oats dalia. Once a week you have give some variety to your this thing. Add some vegetable poha, vegetable upma, खूब सारी vegetables डाल के चीला, ये सब भी खाइए. हर रोज एक ही तरह का मत खाइए, आपको बहुत डिफरेंस लगेगा. एंड मिनिमम ऑफ 2 लीटर्स ऑफ वाटर. अगर आप इतना ड्राई फ्रूट और इतना खसखस वगैरह पी रहे, कम से कम 2 लीटर पानी पर पर्सन.
तो ड्राई फ्रूट्स अच्छा नहीं मैम डेली खाने के लिए?
अच्छा है, लेकिन आप बहुत ज्यादा क्वांटिटी खा रहे हैं, आपकी बॉडी में हेवी हो रहा है, उतना डाइजेस्ट नहीं हो रहा है.
तो बीच बीच में खाना है, मतलब डेली नहीं खाना है?
क्वांटिटी रिड्यूस करिए मैडम, क्वांटिटी कम करिए उसका.
क्योंकि
बहुत ज्यादा क्वांटिटी खा रहे हैं आप.
मैडम सम प्रॉपर डाइट प्लीज. Like
You can
diet.
ask Asha ma'am. You can contact me and I can help you with that. It may not be possible on this platform, but because I have to answer other questions also. But I'll be happy to help you. I can give
Okay,
you
ma'am.
a
Thank
consultation.
you.
Most
Thank you. Thank you.
Hello, ma'am. Hello, ma'am.
Yes.
Hello.
Yes.
Hello. I'm saying that why coconut digestion is difficult rather than the groundnut. Hello.
It's not difficult. It's not difficult. They both have different qualities. They both have different work that they do. They both have different minerals and vitamins in them. So they do both perform different activity in the body. It is not difficult to digest. Can you hear me?
That the fiber content in groundnut and coconut
I can't hear you. Asha ma'am, I can't hear the question.
Sir, please unmute your mic, sir.
Yes, muted. Yeah.
Does Urdu dal gas problems? Urdu dal.
Sangeet, sir, please unmute your mic and then speak, sir.
Hello, Asha ma'am. Can I request you that we can have a recording of this program because there has been some internet problem from my side.
Does Urdu dal cause gas problems? Urdu dal. Idlis and dosa, we add Urdu dal. Does it cause gas problems?
Sir, I'm sure you must be adding some methi seeds to it.
What should I?
Methi seeds.
Oh, methi seed. Oh.
I'm sure you must be adding. It's part of the ingredients. It is generally added. So
Okay.
that will ensure that there is no gas or it's not difficult to digest. Otherwise, in the sambar that is made or in the chutney, you can add a little hing to it while making the tadka. So it will help.
Thank you so much.
Most welcome. I hope the webinar was of some use to everyone and everyone can use a few of the points that were mentioned. And I would be happy to help anyone who needs any further consultation. They can contact Asha ma'am, or my numbers were also posted. You can contact me. I'd be happy to help anyone if they are facing any difficulties. I hope it helped everyone.
This was a wonderful
It was
presentation.
really
You
helpful.
had a
Very,
positive.
very useful information and really helpful.
Thank you.
On the camera screen also that so many senior citizens, they have really these issues of constipation and anemia because of constipation. I am sure they would love to take the advices from you. And the language that you use is so like easily understandable to everyone. And ma'am, more than 75 people, they have joined from all over India, and they really face these type of problem. And those people, those students who enrolled us in tapas, they also joined here, ma'am. And this session is going on live on Facebook and YouTube, so they can view it later also, late about the advices that you shared with them, ma'am. And I am sure like because of your expertization in this subject, many people, they have clear their doubts also, that whether they are taking too much of dry fruits or what problem they are facing. So I'm sure everyone has got some or other knowledge like about the diet, because that itself is a medicine for us.
Yes.
खाने को हम लोग ऐसा बोलते हैं कि दवाई की तरह खाने से अच्छा है, क्योंकि नहीं तो खाने को बचाने के लिए हमें बहुत सारी दवाइयाँ खानी पड़ेगी. So, on behalf of Senior Citizen Division of National Institute of Social Defense, ma'am, I would like to extend my gratitude that you took time from your busy schedule and deliver a session for our senior citizens, for our caregivers, for our students, from the people from RRTC, Senior Citizen Helplines people. So many people have joined us today, ma'am. So, and we are also thankful to all our people, all the participants who has joined us today. And ma'am, tomorrow again we have a session about the chair yoga for senior citizen from one of the resource person from AIMS, All India Institute of Medical Sciences. I would like all of you to join over there. So thank you so much, Tithi ma'am. And whosoever wants madam's number can contact us for further guidance and references.
Thank you. Thank you so much. Thank you everyone for joining and taking out the time. Thank you.
Thank you, ma'am. Thank you very much.
Thank you, madam.
Thank you to our dear participant for asking so many questions also from our expert.
Thank you,
very
Adama.
much, ma'am.
Yeah,
Thanks.
you have been very good. Yeah.
Those interactions actually make purpose of this webinar success, basically.
Yeah.
Thank you so much, ma'am. Thank you so
Thank
much.
you, ma'am.
Thank you.
Bye-bye.
Thank you, ma'am.
Thank you, ma'am.
Thank you. I will ask questions to again and again. Thank you. Thank you, ma'am. I will ask questions again and again.
You may write it in the chat box also if you want.
Sir, what is சொல்லலாம் சார் எல்லாம் தேங்க்யூ ஸோ மச்